appreciate it. And online family, we see you, we see your comments, and thank you so much for participating. And the next speaker is Dr. Biko. He is a reproductive medical specialist and director at Femicare Fertility Clinic and a part-time lecturer at Steve Biko Hospital and Pretoria University. He received his training at the University, Pretoria University, and the Medicine of South Africa. He received his training at the University of Witwatersrand, Pretoria University, the College of Medicine of South Africa, which is Medunsa, and the University of Valencia. He is a member of the team that recently completed the National South African Fertility Guidelines and is also an advanced endoscopic and endometriosis surgeon. Dr. Biko is going to talk about egg and sperm donor cycles, who needs them, and the process. Welcome, Dr. Biko, to the stage. Thank you.
So we're going to talk about eggs and sperms, donor cycles, the indications for that, and the process of doing that. All right. So when a woman is pregnant with a little girl, when she's 6 months pregnant, that little girl has about 6 million eggs in her ovaries. By the time that little girl is born, she is only left with 1 to 2 million eggs. So during the last 3 months of the pregnancy, of a mother's pregnancy, that girl has lost between 4 and 5 million eggs in a mom's womb. Now remember this, once a patient is born, no new eggs are formed. You just keep on losing eggs. So by the time a child has her first menstrual period, she has lost a lot of eggs and only has about 400,000 eggs left. This child will continue to lose eggs every month. About 1 million eggs, about 1,000 eggs will be lost every month, irrespective of whether they're on their periods or they don't see their periods. By the time we turn 40 years of age, there are very few eggs left. But the most important thing is that the quality of the eggs also decline as patients age. What about boys and their sperms? Well, there's a small difference between testes and ovaries in the sense that testes have stem cells inside them. Now, stem cells have the ability to regenerate, to form new cells and form new cells. Therefore, sperm production continues throughout the lifespan of boys and males. What does happen, though, is that the quality and the quantity of the sperms will decline with age. But this decline is not to the same extent as seen with eggs. So the question is this: how do we slow down the loss of eggs? Can we slow down the loss of eggs? Can we manipulate our hormones so that we slow down the rate of loss? Now, if we take contraceptive pills that stop our periods, will that slow down the loss of eggs? What happens during pregnancy? Do patients still lose their eggs when they're pregnant? And importantly, what is the effect of a good health lifestyle have on egg quality? If we exercise, if we eat healthy, if we take all the supplements in the world, are we going to improve our egg count, or are we going to decrease the rate of loss of eggs? Unfortunately, none of those things will decrease the loss rate of eggs. We will lose our eggs at a rate of about 1,000 per month, whatever we do. can we hasten the loss of eggs? Well, the answer is yes. We can't reduce the loss, but we can increase the loss rate of eggs. Smoking has been shown to do that, and patients who are on chemotherapy, those on radiotherapy, there will be excessive loss of eggs, and I think most importantly, which many patients here tend to undergo, is surgery, pelvic surgery, whether it's for endometriosis, for cysts, for fibroids. Now, every time a patient undergoes surgery, we impair the blood supply to the ovaries. If we impair the blood flow to the ovaries, we impair or we increase the loss of eggs. So every surgery that we do, it hastens the loss of eggs. That's why in many units, when we have to operate patients with endometriosis, especially those with stage 4 endometriosis, we require them to first freeze their eggs. So we freeze their eggs and then do the surgery, because I know when I do the surgery, we are going to damage the eggs. So once I've frozen the eggs, then at least we've got something to work with after the surgery. Now, how do you beat your biological clock? Because the clock is there. You can't stop it. It's going to go. You have to try to beat it. Well, you can freeze your ovarian tissue to beat this. You can freeze your eggs. You can use donated eggs or donated embryos. You can use donated sperms. Now, if we freeze a patient's eggs or a patient's ovaries, let's say at the age of 30, and that patient wants to conceive, let's say, at the age of 50, the eggs are still 30 years old, and her success rate will be the same as that of a patient who is 30 years old. We now know that patients are very busy. By the time they turn 30, they want to work on their careers. There isn't time for them to fall pregnant. That's why in our clinics we see mostly patients in the late 30s, in the early 40s, but we haven't frozen their eggs. And the success rate we know is determined by the age of the patient, especially the lady in the main. So now, who needs donor eggs? All patients who are menopausal, who have stopped menstruating, will require donor eggs. In general, all patients above the age of 43 will require donor eggs. But we understand that some patients who are older, 43, 44, 45, they will come to the units and say that, listen, I understand my success rate is low, but at least I want to try so I can reach a conclusion and say, at least I've tried. All right? Then we understand, then we offer them a cycle. But the problem is the success rate of IVF at the age of 43, 44, 45 is extremely low, as we will show in the next slide. Those patients with genetic conditions that we do not want them to transfer to their offspring, we would recommend that they undergo donor egg cycles. And sometimes patients with repeated IVF failure, where we don't find the cause of the failure, we do recommend that they should consider using donor eggs. And obviously, in the same-sex couples who want to have their own family, same-sex male couples, we have to use donor eggs, and they have to use a surrogate as well to carry the baby for them. And one big problem, and it seems it's increasing yearly, is this concept of premature ovarian insufficiency, which the average doctor calls premature menopause. So people call it premature menopause. We don't like the word premature menopause. It's actually premature ovarian insufficiency. Those are situations whereby you get these young girls who run out of eggs, essentially. Somebody's 30 years old, they run out of eggs for whatever reason. Often it's genetic or surgery or something like that. And there are no eggs left in these patients. And often we see it like we said in those girls who had lots of surgeries before, and especially in those patients who had ovarian cystectomies before. Now, before you go back to your doctor and remove your next cyst, remember that removal of that cyst, you are removing a lot of your eggs. In general, there's no place for ovarian cystectomy. Those with previous cancer treatment, obviously we had chemotherapy, also get premature ovarian insufficiency. And then there are those patients who are born with abnormalities that will result in them running out of eggs quickly. Who needs donor sperms? Now the same thing is the same-sex female couples who want to have a child. So they will need donor sperms. Often they ask their friends, or sometimes ask for an anonymous donor. And then those patients, as you had in the previous talk now, where the partner's got no sperms, got azoospermia, testicular azoospermia, where the absent sperm is because of problems in the testes. Sometimes people do not have sperms because when it's not a testis problem, when it's a brain problem. So if it's a brain problem, you don't need donor sperms. We can sort that out, give you the right medication to produce the sperms. But if the problem is in the testes themselves, a primary testicular problem, then these patients will require donor sperms. Testicular problems often arise from testicular trauma and tumors, and often we see these kids with undescended testes who are untreated that can result in permanent damage to their testes. Same as in females when there are genetic abnormalities and when there are antibodies in the sperms, and of course any other chronic medical conditions that impair the quality of the sperms, those couples might require donated sperms. Now, how is the process of egg donation done? Well, the donor can either be known or unknown. So a known donor is, let's say a couple would bring somebody that they know, a family member, a friend, who will then come and donate the sperms for this couple. So what we would then do is to test the donor to make sure that the donor is appropriate. And then once the donor is appropriate, we will then use the donor's eggs for the couple. If the donor is not appropriate, we will just tell the couple that the donor is not appropriate, but we will not tell you the reason why it is not appropriate, because that's confidential. All right, we take a lot of history from the donors, and in our practice, all of them have to see their psychologist to ensure that there are no issues involved here. The process itself is that we would stimulate the donor like we do in IVF, and then we harvest the eggs of the donor, and then we inject or we mix the eggs of the donor with the sperm of the husband of the patient, and then we transfer that embryo in the patient, and the donor is free. The whole process normally lasts a month or so. Now, what is the success rate of donated eggs or donated gametes? Now, if you look at the green slide at the bottom there, the success rate of pregnancy is determined by the age in the main of the mother. You'll see that by the time patients turn 34, you get a rapid decrease in the success rate of pregnancy, to the extent that when they turn 42 years, it's about 10%. When they are 43 years, it's about 5%. That's why many of us will recommend egg donation from the age of 43 years, because the success rate is pretty much low. Now, if you look at the blue slide on top there, that is those patients who use donated eggs. And you will see there the success rate of donated eggs is high because our donors are young. It remains about 40%. In this case, it's about 50 to 60%. Even in those patients who are over the age of 50 years old, the success rate of donated gametes or embryos is very good. So donor cycles do much better than own cycles. So what does the law say now about this? Well, egg and sperm donation is legal in South Africa. In some other countries, it's not legal, but in this country, it is legal. And then we have the Children's Act that protects the children. Now, the Children's Act states that the mother of a child is the woman who is pregnant and delivers the child. It says nothing about the eggs, about the sperms. So as far as a child is defined, it doesn't matter where the eggs come from or the sperm come from. So the person who donates eggs to you cannot tomorrow say that it's her child, but it's not a child, because an egg is not a child. Now, often patients are worried about the genes, but I think there's more to this. It's not only about genes, there's issues about epigenetics as well, because genes is one thing, but the epigenetics or the environment determines what is expressed in the genes and what is not expressed in the genes. So epigenetics is also a very, very important thing. In any case, the genetic differences between all of us here is less than 1%. So in conclusion, more than 30% of our clinic's IVF cycles are donated cycles. In other words, in our clinic, more than 30% of our patients use egg or sperm which have been donated. Now, this technology has made it possible for couples who otherwise would be unable to have their own children to become parents. Donating sperms and eggs is the greatest gift one can give to a couple, because involuntary childlessness is the most stressful factor for a couple. Thank you.